In today's news, active COVID-19 cases in the BVI surpassed 250 mark, with more than 85% on the island of Tortola.
CEO and HR manager at the BVI Health Services Authority abruptly sent on non-disciplinary leave. They have been replaced, and the BVI Health Services Authority Chairman publicly issues a statement. And
Premier Fahie and Deputy Premier Dr.Wheatley test positive for COVID-19. Premier says both are on track to recovery.
BVI Health Services Authority announces their new public access in response, of course, to the rise in COVID-19 cases.
And no visitation at the Dr. D. Orlando Smith Hospital in light of rise in COVID-19 cases. With viewers, we get to these and more stories when 284 News return.
You value traditions. You value music. You value education. Family.
I love you.
Service.
Thank you. You're welcome.
Love. Life. At Popular, we're committed to you and everything our community values. For the things you value the most, count on us. Popular.
Welcome, everybody. It is Wednesday, December 29th, 2022. I'm Ron Grant.
And viewers, I'm Kamal Haynes. And we start today's newscast on the subject of COVID-19, where we see the COVID-19 cases in the British Virgin Islands continue to climb, with total active cases now reaching 256, with more than 85% of the total cases on the mainland of Tortola. Well, viewers, this was confirmed by the Acting Chief Medical Officer, Dr. Ronald Georges, in a statement issued on Tuesday, December 28th, where he said the outbreak is as a result of the Delta variant of the virus being present in the territory. Well, he said, and I quote, "As of the 28th of December 2021, there are 256 reported cases of COVID-19 in the territory, with the majority 218 on Tortola. As previously mentioned, all samples previously sent to CARFA for typing were positive for the Delta variant, and samples continue to be sent for typing on a regular basis," end quote. Well, Dr. Georges said the majority of the clusters have been linked to the entertainment businesses and other establishments which promote social gathering and allow for persons to congregate. He warned residents to remain cognizant of the virus and to adhere to the respective COVID-19 protocols during the holiday period to help minimize transmission of the virus. Well, he said, and I quote, "In this holiday season and during this period of increased transmission, as we prepare to engage in the many families and social gatherings and enjoy the holiday season with our friends and families, let us remember that COVID-19 is still present among us, and we are to intentionally take the necessary precautions for our health and safety," end quote. But the acting CMO also said that local health professionals will be reviewing the recent guidelines issued by the Center for Disease Control and Prevention recently on December 27, 2021, in response to the high prevalence of the Omicron variant in the United States. Well, these new guidelines from the CDC reduced isolation periods to 5 days once symptoms in positive persons have resolved, based on new evidence which they say shows that such persons are no longer infectious. But Dr. Georges said, and I quote, "Researchers has shown that persons are infectious 1 to 2 days prior to the onset of symptoms and 2 to 3 days after onset of symptoms. Well, the new CDC recommendation is that for the remaining 5 days, persons should always wear a well-fitted mask when around others. We will be reviewing these updated guidelines in the next few days and giving updated guidance as required," end quote. Well, he also said the CDC also recommends that those who had a booster dose should simply wear a well-fitted mask when around others for 10 days. Well, their guidance is that all persons should seek to be tested at day 5 after exposure, and if symptoms occur, should immediately isolate until a negative test confirms that symptoms are not due to COVID, or if they become positive, isolate as a case. But we will review this latest CDC guidance and update as required in due course. What the leading health professional said, until a decision is reached on the new COVID-19 protocols, as suggested by the CDC, all persons in the BVI will be required to quarantine for at least 10 days once in direct contact with a positive case has occurred. Well, he said, and I quote, all households or travel companion contacts of cases in the Virgin Islands should at least this time be quarantined and be tested at least 10 days after their last exposure, or 7 days if they are not quarantining with a case in the same location. In the Virgin Islands, we are currently requiring persons with unprotected contact of confirmed cases to self-isolate and wear a well-fitted mask when around others for a period of 14 days, end quote. Dr. George said that his team of professionals will also be reviewing some of the current government policies on controlling and suppressing the COVID-19 virus to decide if any changes need to be made to the existing protocols. Well, Ron, here in the BVI, we see cases going back past the 200 mark for the first time since I believe July, August this year, where we would have had that last spike. But we must also note that it's not only in the BVI where we're seeing an increase in cases, as you would get to your story later on, where we see more than 700 positive cases in the United States Virgin Islands.
Yes, absolutely, Kamal, and you're absolutely right. Many of the Caribbean regions that we are speaking about in our newscast, not only today, they too are experiencing the very same thing. Viewers, we're going to take a quick commercial break. We'll be right back.
The wait is over. CCT Fire is here. Experience ultra-fast downloads, seamless streaming, and even more reliable connectivity on an all-new fire-blazing super-fast CCT Fiber network. CCT Fire. Bring it home and upgrade today.
Ladies and gentlemen, it's a brand new season of The Art of a Distinguished Gentleman, a show poised to help guide modern-day men into 21st century distinguished gentlemen. It doesn't always involve suits and, bow ties, but raw, real-life lessons that translate to grounded, community-minded, well-rounded men. This season, I'm taking you on an entirely different journey, from chefs to dancers, philanthropists, communications specialists, and much more. I'm heading outside in the field to share the journey of some of the BVI's best and brightest men. From East End to West End, Borgingada, Justin Lake, not forgetting Antigua. Our Virgin Islands gentlemen are doing the damn thing, and I'm so proud. Get ready to reason, reflect, and redirect. We are the movers and shakers of this generation, and we ain't afraid to show it. The Art of a Distinguished Gentleman, Season 3 by yours truly, Ron Grant, raising a generation of greatness.
Viewers, welcome back. Thank you so much for sticking with us. Now, continuing on the news of COVID-19, in a media release issued today, December 29th, 2021, the British Virgin Islands Health Services Authority is notifying the public that in light of the current uptake in active COVID-19 cases within the territory of the Virgin Islands, a decision was made to briefly suspend visitation to the inpatient units at the emergency rooms at the Dr. D. Orlando Smith Hospital. Now, access viewers to the pharmacy and allied health services will be in a controlled manner with strict observation of all the relevant public health protocols. This decision is a temporary action being taken to ensure the safety of our patients, they say, and staff during this very fluid situation. Now, continuing on the matter of the BVI Health Services Authority, recently today, we published a story stating that, of course, as you would know, the CEO, Mrs. Cordine Malone, as well as Mr. Lavore Letton, the Human Resources Manager, were sent home on disciplinary, that's non-disciplinary leave. Now, in a recent received media release from the BVI Health Service Authority, Chairman of the Board of Directors, Mr. Molito Smith, has officially issued a statement essentially saying that those persons have been replaced following the abrupt non-disciplinary dismissal of the Chief Executive Officer, Mrs. Cordine Patricia Malone Smith, who is Photo and Human Resources Manager, Mr. Lavore Letson. Now, tweet for media viewers delayed reporting on the matter as our newsroom reached out to the Health Minister, the Honorable Carvin Malone, who assured that an official statement would be forthcoming from the agency. Now, that statement finally came today, and the statement received today, December 29th, 2021, stated from Mr. Molito A. Smith, the Chairman of the Board of Directors, and I quote, "This serves as a notification of a current initiative of the BVI Health Service Authority Board of Directors aimed at increasing the efficiency and effectiveness of service delivery pursuant to a September 28 decision, the board requested the assistance of the BVI government Department of Internal Audit to conduct an independent review of all functional operational components within the BVI Health Services Authority, including areas of high priority for the board. He continued by saying the principal aim of this request is to glean independent recommendations to strengthen the efficiency, effectiveness, and sustainability of the BVI Health Services Authority. Commencement of this initiative is currently underway. The statement continued, viewers, by saying in order to best facilitate this process, individuals in certain positions within specific functional operations areas be reviewed may be placed on a hiatus during the review process. As a result of these changes, the public is now advised of the following during the initial phase of this process, that is effective 5:01 p.m. on Tuesday, December 14th, 2021. Ms. Angelina John, BVI Health Service Authority Chief Financial Officer, has been designated as the interim Chief Executive Officer by the BVI Health Services Authority Board of Directors until such time as the initial phase of audit review is completed or such time as determined by the board. Effective 5:01 p.m. Thursday, December 16th, 2021 through January 10th, 2022, which represents the period for which Ms. John is on an approved vacation leave, Dr. June Samuel, BVI Health Service Authority Chief of Medical Staff, has been reassigned, designated as Interim Chief Executive Officer by the BVI Health Service Authority Board, and effective 8 a.m. Monday, December 20th, 2021, Ms. Ishma Edwards, BVI Health Service Authority Patient Experience Manager, has been reassigned and designated as Interim Human Resources Manager until the completion of the internal phase of the audit review of such time as determined by the BVI Health Services Authority. Now, viewers, as you can see based on our previous story that was published on our website, the key individuals who were essentially sent on non-disciplinary leave have essentially been replaced, and the board of directors, that is by way of the chairman, Mr. Molito A. Smith, are citing efficiency and essentially just a review of assignments pending an audit report.
Indeed, Ron, as you would have said previously, there was supposed to be somewhat of a statement in direct response to basically explain the leave
Right.
of those two key individuals, but in essence what they would have just said is just somewhat of a press release that's basically stating that the persons have been replaced and who are replacing them essentially in somewhat quote unquote an initiative of the BVI Health Services Authority, but ultimately there's still no word as it pertains to why
these persons
would have been let go, considering especially Ms. Malone Smith, considering she would have been highly praised during the COVID-19 period for the tremendous work she would have been doing under that acting CEO role on the BVI Health Services Authority, then to be let go without explanation.
Yes.
It's somewhat concerning, it's somewhat questionable, and we viewers will continue to dig into that to find out the truth behind those that particular decision.
Kamal, before we continue, I just want to add, though, that just as Ms. Malone Smith was praised, Mr. Lavore Letsum, too, he, too, was essentially axed and gave up a position at Human Resources Manager, was offered a position at the Human Resources Manager at the BVI Ports Authority while he was at the BVI Health Services Authority, and essentially was asked to stay and take up their mantle at Human Resources at the BVI Health Service Authority only now, within a very short period of time, to be let go. So I know there, not only from the public perception, but amongst staff at the BVI Health Services Authority, there are many questions that persons want to be answered.
And also, too, just on this statement that you would have read just now that would have been issued to you from the Board of Directors, what I'm saying here, basically, what it says is in order to facilitate the process, individuals in certain positions within specific functional and operational areas to be reviewed may be placed on hiatus during the review process. So in essence, it's basically stating that is a possibility that those two persons could be on hiatus while their positions are reviewed, and who knows what may happen afterwards. So they're basically leaving it somewhat of an open-ended response for persons to basically interpret what is really the case.
Which could be very damaging to these individuals.
Indeed. Well, viewers, up next, Premier Fahie and Deputy Premier Dr.Wheatley test positive for COVID-19. Premier says both are on track to recovery. And the BVI Health Services Authority announces new public access in response to the rise in COVID-19 cases. But these and more stories after a word from our sponsors.
So you're saying I can ask this cat any question?
The cat is connected to the computer. You just type in the question, it will read his mind. There the answer comes.
You're the man! I've been looking for this for weeks.
Well, welcome back, viewers. Well, both the Premier and Deputy Premier of the British Virgin Islands have tested positive for the COVID-19 virus. Well, in a late statement on Christmas Eve, Premier Andrew Fahie informed the public that he had tested positive for the virus after being in close contact with Deputy Premier Dr. Wheatley, who previously tested positive for the virus. Well, he said, and I quote, "Well, I must also inform that during the early part of this afternoon, I was informed by the health officials for the need to have me tested as a result of me being in close contact with someone who had recently tested positive for COVID-19. As a result, late this afternoon, 24th December 2021, I was tested for COVID-19 and the results returned as positive. Well, the testing was consistent with the established protocols where our Deputy Premier and Minister for Education, Culture, Youth Affairs, Fisheries and Agriculture, Dr. Honorable Wheatley, recently tested positive for COVID-19 and all his listed recent contacts, of which I was one, required to also be tested," end quote. Well, Premier Fahie also said that none of his close contacts, including his entire family, have so far returned negative results for the virus after undergoing recent testing. Well, he also said he will be isolating for the 10 required days and assured the public that he and Dr. Wheatley were all in good spirits as they both felt strong. Well, he also said that due to the aforementioned results, "I am following the instructions of the health professionals to isolate for 10 days. I have also been advised that due to being fully vaccinated and having recently taken the booster shot, this has contributed to my immune system being in the best possible position to fight off the virus and its possible negative effects, thereby giving me the best chance for a full and fast recovery. Well, I want the public from District 1 to 9 to know that I am in good spirits, I am feeling as normal as can be, and I continue to perform my duties and responsibilities as Premier remotely. I am pleased to report also that the Deputy Premier is also feeling strong and is also expected to have a full recovery. He also continues to perform the duties of his office remotely," Premier Fahie added. Around here, we see as the cases continue to rise, we not only see affecting establishments and different various businesses, what we also see is affecting top officials like the Premier and also the Deputy Premier, the two basically heads of the territory. And it goes to show that COVID is real, COVID is still around. As the Minister for Health would always say, we're not out of the woods, and here we are seeing the direct impact of the COVID-19 virus in the BVI.
And we have seen this come out across the region. Many leaders have contracted the virus. We're thankful that both our Premier and Deputy Premier are in the best of spirits and are expected to make a full recovery. We are looking forward to seeing them face to face very soon. Now, the BVI Health Services Authority is reintroducing precautionary measures as a response, of course, to the current uptick in COVID-19 cases. Now, since the start, viewers, of the COVID-19 pandemic, the BVI Health Services Authority has really reintroduced a number of protocols to address various pandemic-related scenarios. In consideration of the current spike in COVID-19 positive cases, the management team of the BVI Health Services Authority has decided to upgrade the organization's safeguarding strategy. It was decided that the first of a two-step approach will be focused on internal protection. As such, management decided that all BVIHSA staff providing inpatient care and patients will be tested periodically to ensure the continued safety of staff and patients. Now, these tests will be carried out by the Employee Health Unit. In the event an employee tests positive for COVID-19, BVIHSA wishes to inform that their supervisor will be notified, and each case will be handled as per the Ministry of Health's COVID-19 protocols. Affected employees may be asked to remain home for a specified period. In tandem with the test results, the BVIHSA will implement various safeguarding and social distancing protocols to minimize COVID-19 exposure within the organization. Now, the second viewer's step of external is nature, as the organization has reintroduced a restricted visitation policy. Now, visitation to the sick and shut-in is something that we are so accustomed to here in the BVI. However, this second step is in keeping with the BVIHSA's commitment to patient safety. The new visitation policy has altered the hours of public access as such, effective December 26, 2021 until further notice. Visitation has been reduced to 1 p.m. to 4 p.m. and only one visitor is allowed at a time for a maximum of 30 minutes. However, please note that special considerations will be given for the Neural Tension Intense Care Center for our kids and the ICU, pediatrics, and patients with special circumstances. The agency really is also reminding the public that vaccination has proven, they say, to be the best protection against COVID-19, and they are encouraging all to do their part to protect their loved ones by getting vaccinated.
Indeed, as we continue to see how COVID-19 continues to impact the territory and the health services. Well, viewers, up next, 786 COVID-19 cases reported as the Omicron variant spreads in the United States Virgin Islands. And regionally, we continue to see Barbadians to take the polls next month as Barbados Prime Minister Mottley calls snap election for January 19, 2022. But we get to these stories when 284 News return.
Brilliant Hands and Minds tutoring services, one-on-one tutorials in math and English, intense homework assistance, academic enrichment, school projects, effective communication and public speaking development, sign language for adults and children on Saturdays only. Registered with the Virgin Islands High School Certificate Program, Brilliant Hands and Minds can help you too. Offering intense curriculum-based training to help you or your loved ones get their high school diploma. It's time to make your family's education a #1 priority. Hurry, space is limited. Brilliant Hands and Minds Learning Center. We are the trained education professionals. Viewers, welcome back. Thank you for sticking with us. We're panning across to the U.S. Virgin Islands, where the VI Consortium has reported that the VI Department of Health on Tuesday reported some 786 active cases of COVID-19 in the U.S. islands as a result of the new variant's extremely high transmittability, with both districts seeing high levels of the spread. Now, the latest increase, viewers, another record that blew past Sunday's 544 sent the territory's COVID positive rate to 14.82%. And when we look at the comparison, last week Monday, positively, the rate was 1.6% versus the present 14.82. Now, the Department of Health issued a statement calling for residents to follow safety protocols, with some 786 active COVID-19 cases reported and a 7-day positivity average of 14.82%. It is more crucial than ever, they say, for Virgin Islanders and visitors to practice social distancing, washing their hands frequently, wear a mask, and avoid gatherings. Of course, anyone 5 years and older and up can get the COVID-19 vaccine, the health department said on Tuesday. Now, a lot's coming into this story, Kamal. Of course, there has been new mandates in the USVI as it pertains to bars and the restrictions and the times. Of course, bars are now closed at midnight, with last call for alcohol being at 11. So we see where there is a huge domino effect, and persons, particularly in the USVI, Governor Bryant and his team have issued new mandates, really in essence of trying to protect Virgin Islanders, and we do wish our visitors and friends over in the USVI the very best of health. As of Tuesday afternoon, there were quite a number of cases on St. Croix. That's 396 active cases, following closely behind at St. Thomas with 381, and at St. John there were 9 active cases. The numbers in St. Croix and St. Thomas are the highest since the onset of the pandemic, and Governor Bryan took steps, really, as we mentioned, to curtail the spread of the variant in the territory, really speaking to the need for persons to really do what they're required, to take precautionary measures, and really take into consideration the health and welfare and the safety of Virgin Islanders and residents. Again, we do sincerely wish our residents and friends over in the USVI the very best of health.
Indeed, Ron, and as we see in various respective Caribbean countries, a resurgence of a number of spikes, not only in the USVI, and as we would see now in the territory, we also see a spike in Barbados. There's also a spike going on in Trinidad and Tobago, as you would have seen the Omicron variant basically being detected in Trinidad and also detected in Jamaica this week as well. So we're saying with the surge now, most of these new surge in cases are as a direct result of this new strain of the COVID-19 virus.
That is highly contagious.
Very highly contagious. Well, viewers, moving on to our final story, where Barbadians will be taken to the polls on January 19, 2022 to vote for their government of choice after Prime Minister Mottley announced a snap election some 18 months earlier than expected. Mottley made the announcement late Monday night during a 37-minute radio and television broadcast, where she urged Barbadians to go and exercise their democratic franchise. What she said, she advised President Sandra Mason to declare January 3rd as nomination day, adding that the decision to hold the general elections at a much earlier date than expected is one that is above party politics.
Accordingly, my friends, I earlier this evening met with Her Excellency, the Most Honorable Dame Sandra Mason, President of Barbados, and advised that she dissolve the current Barbados Parliament with immediate effect. I further advised Her Excellency that she, not on behalf of Her Majesty the Queen, but in her own right, as President of the Republic of Barbados, issue writs for the holding of the new elections in Barbados. I know that we're still in the midst of COVID, but as we've all agreed, COVID will be with us for a while. It is my intention to have meetings convened of the Electoral and Boundaries Commission and the COVID Cabinet Subcommittee so that they may advise how best we structure the actual voting process to reflect an appreciation of the realities of COVID in our midst. I will also ensure that the Leader of the Opposition and myself are fully briefed after these meetings, and that we can update you in a matter of days on any agreed upon changes with respect to simplifying the conduct of elections in this environment.
Well, Prime Minister Mottley said she did not want the Barbadian public going into 2022 as a divided nation, stating that if she was motivated solely by the need to survive, she would have relaxed with her 29-1 parliament and ridden out the COVID-19 wave for the next 18 months.
Defeating COVID would not be a benchmark. Surviving it would be the acid test. Were I motivated solely by what is in the interest of the Barbados Labour Party, I would say run the innings down to the last ball and hedge my bets that by June of 2023, we would be emerging, if not having already emerged, from the brunt of the COVID pandemic. But my friends, my worry is now. I'm concerned that if we start 2022 as a divided nation, we will stunt and frustrate our own progress, and what we do today stands to affect this country for the next 20 to 30 years. And we are willing to take the risk because we would rather depart, leaving Barbados on course to recovery, than grapple for the next 18 months with a divided nation, not making the most of the opportunities that this new COVID environment presents. I'm prepared to make those decisions, even if it means foregoing the next 18 months of this government's term that was received with 74% of the popular vote. Why? Because Barbados and Barbadians deserve better. And simply remaining at the crease to say that you were at the crease has never been a successful measure to be able to attain progress in this nation. Not in cricket, not in politics, not in nation building.
Well, viewers, Barbados' Prime Minister Mottley's BLP, Barbados Labour Party, is expected to face a main challenge from the Democratic Labour Party, which she swept aside in 2018. Well, viewers, that's all we have for today's news roundup. Be sure to follow us for daily news updates at 284media.com And like us on Facebook at 284 Media and 284 BVI on Instagram and Twitter. I'm Kamal Haynes.
And I'm Ron Grant. It is always a pleasure. We're happy to be back, and we hope you had a beautiful Christmas. Looking forward to an even more enjoyable New Year's Eve and beginning of a fantastic 2022. See you soon. Have a beautiful night. Bye-bye.